Medical Affairs at Hello Heart. Dr. Morgan, thank you so much for joining us. We appreciate it.
Sure, Lisa. It's my pleasure.
What are your concerns about people not being safe when they're outside shoveling?
You know, when we look at these storms, they really are a cardiovascular storm, sort of a perfect cardiovascular storm. And what happens when people are out shoveling snow? It's an isometric movement. It requires upper body dominance. It often requires people holding their breath. This Valsalva maneuver, which increases plaque disruption. And then also in storms, sometimes you're stranded. You're without your blood pressure medications. Hypertension, uncontrolled hypertension, is one of the most singular contributors to heart attacks during these big snowstorms.
And then do you think people should delay shoveling?
You know, if you must shovel, I would say go out with a partner. Make sure you have someone with you. Maybe take breaks every 10 minutes. You know, the challenge is usually people who are out shoveling snow are also tend to be deconditioned. And so be realistic about what your physical condition is. If in fact you absolutely need to shovel snow for some life-threatening situation, have a partner, take breaks every 10 minutes, stay hydrated. People think about hydration in hot weather, but hydration is really important in cold weather. Your vessels are constricted in that cold weather. It's making your heart work harder.
And then in terms of like I mean, it really is exercise to shovel snow. We've heard, a lot of people just like to just take the biggest amount they can. We're expecting very heavy snowfalls here in our area. Shorter methods, shorter shoveling efforts and moves are better.
Yeah, if you can maximally affect your movements, that's always best. Try not to lift more than you really can handle. So more movements as opposed to smaller, big movements are always better. And keep in mind that during these storms, the rates of emergency room visits for heart attacks increase, the rates of death for cardiovascular events increase, and the rates of hospitalizations for heart failure admissions increase.
Exactly.
And that's not by happenstance. This is what happens with your cardiac system during these big storms.
And also the response time too can be affected for help on its way for that. Dr. Morgan, thank you so much for sharing your advice and insight with us. We appreciate it.
Thank you. That's a great point, Lisa.
Okay, thank you. And